Hello, good morning. I'm Farhan here. So today I will talk about the hamstring muscle injury. Hamstring, or otherwise we can call also the pull hamstring is common occur condition we find in the athletes. Usually, the athlete we sustain this injury which is involved with sprinting activities, jumping, also dancing. Or kicking. So first of all, for the anatomy hamstring, there is consists of three muscles, which is first is bicep femoris. It's the most lateral part. For the most medial part is the semi-membranosus and then the semi-tendinosus. So for the bicep femoris, there is consists of two muscles, which is divided by long head and short head. Both is origin from the long head is origin from the ischial tuberosity, while the short head is origin from the linea aspera from the posterior surface of the femur. So both of these muscle was inserted at the head of fibula. The main action for the bicep femoris is to flex the knee and also extend the hip, and also to laterally rotates the hip and also knee. So the second muscle is semi-membranosus. Semi-membranosus is the largest muscle in the hamstring. Is originate from the ischial tuberosity and then going down attached to the medial tibial condyle. Same function as bicep femoris for the flex knee and also extension of the hip, but it medially rotates of the thigh and also leg. So the third muscle is semitendinosus, which is originates also from the ischial tuberosity, but it inserts to the pes anserinus at the middle part of the tibia. So what is the mechanism of the hamstring injury? We must remember there is a phenomenon occur as called as a eccentric contraction, which is the muscle was extend while the loading was given to the muscle, such as for the sprinting activity or jumping. Can be also when the patient perform the kicking. Okay, so what is the risk factor? We can divide to two, intrinsics or extrinsics. For the intrinsics, such as, for example, age of the patient, and also the weight of the patient itself, and so BMI. The athletes who have the muscle imbalance, which is the increase of the quadricep pector, and also the imbalance of the hamstring quadricep ratio. And then the individual also the previous injury of the hamstring history, and also muscle tightness and also poor conditioning. So the second risk factor is extrinsic. This is the choice of the activity, such as for the running, sprinting, dancing, or athlete was involved with the sport in football, American football, soccer, and also basketball. So other than that, for the extrinsic, the factors can be also happen in the adolescents athletes who are still in growing lah. This is, we believe, because of the child bones is growing faster compared to the muscle. What is the grading of the injury? There is three of grade 1, grade 2, and grade 3. For the grade 1, there is a mild pain, or swelling at the posterior thigh of knee, but cannot appreciate any the tissue disruptions, and also minimal or no loss of the function. Grade 2 is identified of the partial disruptions of the along the tendon with moderate pain and swelling, and then moderate pain and swelling can lead to the loss of the function. Grade 3 is a complete disruption of the tendon, of the musculotendinosus with severe pain and definitely have a lack function of the activity. So usually person who have experience with the hamstring injury will complain of the sharp pain at the posterior thigh of the posterior of the thigh when they are wet bearing. So they also have an antegic gait, which is stiff leg, as a result of the avoiding to do the hip and knee flexions, and then swelling, and then if the injury was happen more than 3 days, we can see also for the ecchymosis at the skin. So while the physical examination, usually we can have a localized swelling with the point of the tenderness along the muscle bellies. and then we can also felt the defect if the the complete rupture of the tendon, and also reduce range of motion and also reduce of the power. So what the test we usually do is first is SLR to passively leg raise with the straight of the knee, and then the second one is resisted knee flexion to test for the power and also if there is any pain. So positive if there is weakness or pain. Okay. So what is the evaluation we can do? First of all, we can do for the plain X-ray to rule out the bony fracture, especially for apophyseal fracture. And then the second one, we can perform the dynamic assessment with ultrasound, which is the sensitivity is more if we doing in the early phase of the injury. And then the last one is the gold standard MRI. So this one we can do to differentiate for the new injury or chronic injury, and then also we can estimate the phase of the rehabilitation for the patient lah. So for the treatment of the hamstring injury, literature says there is no specific evidence to approach with this injury, but based on the clinical experience and also based on the biological basis of the tissue repair itself lah. So for the grade 1, grade 2, we can purpose for the conservative, non-pharmaco and pharmacologically. For non-pharmaco, usually we ask the patient to have a RICE protocol, rest, ice compression, and also elevate the limb. And then for the pharmaco, we can give the patient for the NSAIDs and also for the painkiller, such as opioid. Okay. So for the grade 3, we can also manage non-pharmaco and pharmaco. And then, but literature says is recommended to do the surgery because of to prevent of the inability to resume. So to prevent the to make sure to allow the patient to go back for the active lifestyle, and then to prevent the chronic knee flexion weakness and also the sciatic neuralgia. So what is the differential diagnosis for the hamstring injury? The first, for the proximal thigh, can be the piriformis syndrome, sacroiliac injury, and then also lumbosacral radiculopathy and facet syndrome. For the distal thigh, the differential diagnosis can be, one is DVT, rupture of the Becker's, and meniscus injury or popliteal injury. So the complication for the hamstring injury, if we not manage adequately, can be a chronic hamstring pain and injury, which is associated with the too early return to play. The second one can have chances of re-injured because of the related of the what we call the calcification and inflammation of the area. And then the third one is hamstring syndrome, which is hamstring syndrome because of the scar formation may impinge the nerve. Okay, so a patient might have a sciatic nerve pain. So prevention for this injury, we can educate the athlete to do the proper stretching and so proper strengthening exercise, and then make sure they have adequate rest between the interval of training, and then athlete itself themselves must know what is the sign of the injury. So if they have the sign, so that they can prevent to do further of the training. And then we can educate also for the younger patient, tell them there is high chances to them for them to get this injury. Okay, so I think that's all. Thank you.